in 10 women experience postpartum depression. Postpartum depression is a highly researched matter that affects many mothers yearly. I have done extensive research and I will be using credible sources and evidence to talk to postpartum depression. In this speech, I will be discussing the factors and symptoms that go into the development of postpartum depression. I will tell of the frequency it occurs in mothers and the effect it has on their children. Postpartum depression is a mental health disorder developed after a mother gives birth. Mothers will experience depressive symptoms and a disconnection from their child. This disorder can be timid, but also can develop into something much more serious. Mothers may experience PPD for many reasons, from pre-existing disorders or through environmental factors. The biggest factor is timing. The longer you ignore your symptoms and treatment, the worse off you are. If a mother had an unexpected pregnancy in a time of her life when she is not financially stable or has a restricting job, this can increase the amount of stress that the mother is in and can make her more vulnerable for these symptoms and this disorder to take over. The article Biological Aspects of Postpartum Depression by Abby Schulk states, unplanned pregnancy, pregnancy complications, and delivery modes have been debated as a potential risk factor. Although it is up for debate, the occurrence of an unplanned pregnancy can lead to other factors in life, again, like stress levels. If a mother has a pre-existing mental health condition like depression, anxiety, or bipolar disorder, this can heighten the chance of inhabiting PPD. There are a variety of different postnatal disorders other than postpartum depression, and they all range in the seriousness. I will be talking about the 3 most common that I found. There are many out there. And I'm going to start with the most common type, which is the baby blues. This one is the most common and is the most mild. The article Postpartum Depression by Sarah Thurgood states that the baby blues occurs in 50 to 80% of new mothers. The symptoms include crying, anxiety, fatigue, insomnia, anger, and irritability. It is very common, and at this stage it is usually non-life-threatening, but can also lead to more serious conditions if left untreated. More mothers experience baby blues than documented, and maybe that the mother may even realize because it can be so mild in a mother. If a mother experiences the baby blues and ignores treatment, it can evolve into a much more serious condition. From that same article, Thurgood explains this by mentioning, while considered normal, the blues can evolve into a full-blown PPD if symptoms last longer than 2 weeks. The major difference between the baby blues and postpartum depression is the time frame in which the mother experiences these symptoms. These two conditions are closely related, and the description of the symptoms are almost identical. I'll be moving up in severity by talking about postpartum obsessive compulsive disorder. This disorder is a step up from postpartum depression, and it starts to get more life-threatening. In this disorder, a mother's mind will unconsciously begin filling with unwanted thoughts that lead to a change in behavior, whether that be towards her child, her spouse, or other people around her. This condition is very recognizable to the mother herself and can be very easily diagnosed. Thurgood states in this article, women recognize their obsessions as their own thoughts and feelings and understand the follow-through would be wrong. This case of postnatal disorder is usually harmless, but can become dangerous without any proper treatment. There are many more severe disorders that can become more life-threatening if not treated, like postpartum psychosis. Postpartum psychosis is the most severe and serious form of postnatal disorder. This disorder is very rare and is developed over a long period of time. The symptoms may include delusions, loss of touch with reality, insomnia, confusion, paranoia, and there are so many more. The same article states women suffering from PPP are not aware that their thoughts and feelings are their own and often act on their delusions, 5% of which results in suicide. PPP can result in death of the mother and or the baby. If not caught early, it can be very dangerous and the recovery process can be very extensive. There are many different treatment options that include affordability and accessibility. I will now tell you how postnatal disorders can have an effect on people around the mother. From the article Postpartum Depression and Child Development, Murray states, infants of depressed women were rated worse on measures of state physical activity, facial expressions, vocalizations, and fussing. When mothers experience a postnatal disorder, it can also affect their children. Babies can experience late motor development issues, as well experience troubles with their social skills later on. Babies seem to be more fussy if they're born of a mother that suffers from PPD. Treatment can help prevent the effect a mother has on her offspring and her spouse. There are many different treatment options for the different severity that a mother experiences, and I'm going to start with the baby blues. Baby blues is the most common and again the most mild. So usually for the baby blues, you either go to therapy, talk to someone, or you can wait it out. But if you wait it out, you got to make sure that you monitor yourself as well as some people monitoring around you, again, because it can progress and become more serious. There's also a new medication offered called Zulresso, which is a piggyback drug of Vexilone, which was the first approved postpartum depression pill. Zulresso was approved by the U.S. Food and Drug Administration and is very expensive. The article, There's a New Pill for Postpartum Depression, but many at-risk women face hurdles, states, therapeutics under the brand name Zurzuvae comes with a hefty price tag of nearly $16,000 for a 2-week process. There are a lot of preterms that need to be met before a doctor will even consider prescribing it to someone. Without treatment, many mothers can experience a prolonged period of depressive symptoms that tend to worsen with time. From the article, Postpartum Depression, Identification, Screening, and Treatment, Perfetti states, without treatment, 30 to 70% of those women may experience depression for a year or longer. This speech discussed the factors that go into the development of a variety of postnatal disorders and the different symptoms they each display. It includes the effect postpartum depression has on children and the treatment options available. Postpartum depression has a very high survival rate and is a very common occurrence in women. I hope from this speech that you learned a little bit more about postpartum depression, and if you ever experience it in your life, you might have an easier way of diagnosing it now that you know. Thank you.